Hi, good morning. Today I am going to explain the pharmacology of Amphotericin-B. Amphotericin-B comes under the antifungal category. It's a polyene antibiotics. Based upon the concentration, it acts as a fungistatic or fungicidal. Once we see the structure of Amphotericin-B, the one side, the several conjugated double bond is there that is responsible for lipophilic nature of the drug. At the same time, the parallelly several number of hydroxyl group is there, so it's balance the hydrophilic nature of the drug. But overall, the Amphotericin-B is a lipophilic in nature. Next, we are moving to the mechanism action. Fungi is the best example for eukaryotes. So it's having a both outer cell wall and cell membrane. So this cell membrane is made up of the main constituents is called as ergosterol. So some other antifungal drugs, example ketoconazole drugs, it's going to inhibit the ergosterol biosynthesis. Our drug Amphotericin-B also is going to target it for the ergosterol. But which way means this polyene antibiotics it's going to bind with ergosterol to make a micropores. So through that micropores, the intracellular constituents, particularly the important monovalent ions and water-soluble constituents, example amino acids, these are the constituents are leak out from the cells, it's lead to death. That's a mechanism. If you want a single line mechanism, you can write like that. This Amphotericin-B is going to bind with ergosterol to make a micropores. It's lead to leak out of cell constituents. That's enough. Amphotericin-B is effective against various fungus. So I have listed out the organism here. And apart from that, it's effective against some of the protozoa. Example, Chalazar and Leishmaniasis also. Next, pharmacokinetic properties. This Amphotericin-B is lipophilic in nature. So water solubility is poor. At the same time, the half-life of the drug is 15 days. What is the reason behind that means? It's more lipophilic in nature, so it's going to bind with the cholesterol and lipoproteins. So it's having a long half-life. Partially metabolized in liver, more than 60% of drug metabolized in liver and eliminated through urine and also bile. Next, adverse drug reaction. The major adverse drug reaction is chillness, fever. What is the reason behind that means? Once we are administered the drug, immediately it's going to activate the release of various inflammatory mediators like cytokinins. So that is the reason behind the chillness and fever. This reaction has been overcome by administration of hydrocortisone 0.6 mg per kg. The main area of this drug is it's producing nephrotoxicity. Particularly, it's going to damage the renal tubular cells. So that is the reason it's going to produce the muscle spasm and arrhythmias. The renal tubular cell is going to damage. It can't able to retain the potassium. It's producing hypokalemia. That is the reason for hypotension, muscle spasm and cardiac arrhythmias. CNS toxicity is very less because this drug can't able to cross the BBB. Once in fungal meningitis case we are inject the drug to intrathecal administration, it produces CNS toxicity. This Amphotericin-B is available as a topical formulation, oral tablet and injection route also. For topical formulation, we can use for cutaneous infections. The oral absorption is poor, so only it's used for intestinal mycosis condition. The conventional Amphotericin-B is available in the dry powder, so it's mixed with water for injection and diluted with DNS. So we must to administer the drug with slow IV infusion. Apart from that, nowadays the Amphotericin-B is available in the liposomal preparation to overcome the unwanted side effects at the same time to achieve the better therapeutic effect. In some other video, I will explain about the liposomal preparation and its benefit. Next, we move into the important section, the drug interaction. The first interactive drug is some of the diuretics. The drugs it's produces hypokalemia. Our Amphotericin-B also it's produce hypokalemia. So it may cause worsen the condition, particularly the cardiac arrhythmias. So it's contraindicated with CVS patients. And nephrotoxic drugs, example cisplatin and aminoglycoside antibiotics. These are the drugs that already damage the renal. So our Amphotericin-B also is damage the renal tubular cells. So the condition has become very worse. It's lead to renal failure. Some of the antiviral drugs also, example foscarnet or ganciclovir. These are the drugs also interacted with our Amphotericin-B. It's producing nephrotoxicity. Then important beneficial drug interaction is amphotericin-B along with flucytosine. Flucytosine also comes under the antifungal drugs. When we are administer the flucytosine along with amphotericin-B, we can achieve the supraadditive effect because this because our amphotericin-B it facilitate the entry of flucytosine towards the fungus cell, so we can achieve the supraadditive effect. So that is a major drug interaction. Next, therapeutic usage of amphotericin-B. It's used for topical candidiasis and also it's used for cutaneous and vaginal and otomycosis conditions. This is drug of choice for life-threatening mycotic infection and also it's used for HIV patient for avoid the relapse of histoplasmosis condition and also it's used for candidias mediated cystis. We already see that amphotericin-B is not only effective for fungus, it's also effective against some of the protozoa. Example, the colors are particularly the resistant cases and cutaneous leishmaniasis. So, this is overall pharmacology of amphotericin-B. I hope you got some information from this video. Thank you for watching.